Social Services, the Environmental Health Administrator, Marilou Scroggs, and the PIO, Janela Carrera. Good morning, ladies.
Hi, good morning. Good morning, Chris. Good morning, Bree.
Good morning.
Unmute, Marilou.
Good morning, Chris, and good morning, Sabrina.
Good morning.
Good morning. So let me just start with something we talked about earlier. So I went out to Rotary Sushi the other night, and when I dined there a month ago, the Rotary part was open and you could get the plates of the sushi. When I went to dine there the other night, it was closed off. And I said, oh, what happened? And they said, oh, public health came in here. And they're like, oh, no, you can't be doing that.
Oh, wow.
So, I mean, I know that's a little anecdotal, but maybe you could start with that and then kind of, Marilou, if you can, talk about the different inspections that you guys are conducting with the COVID protocols in restaurants and businesses.
Okay, so at this time, we've been busy conducting assessment on the school because they're back to face-to-face learning. We've done GCC, and we're so impressed with their plan and their protocols. They're really following their plan and adhering to the executive order and public health guidance. We did JFK yesterday, and we're more impressed because they're really following their COVID plans and adhering to the executive order and public health guidance. Maybe because there are not much students that still attending this face-to-face learning. As per our staff, there's even a class there's only one student or two students in a class. So at this time, we don't have any issues or problems with the school, and we're continuing to do that. On Wednesday and Thursday, that's the only time that we do public schools because that's their schedule for face-to-face learning. So on Monday, Tuesday, and Friday, we will be assessing the private schools, just like the Catholic and Christian schools. And there's a CDC representative that's following us and assisting us in doing the assessment to make sure that they're in line or they're following the CDC guidelines, public health, and the executive orders.
When does that when does that begin? I'm sorry.
It dropped.
When does
Yes,
that, I'm sorry. When does that begin?
When it comes to complaints, it really dropped. We're only receiving few complaints right now because maybe the congregation was went up to 25.
Mm-hmm.
So we don't receive much complaints at this time.
So how long have you guys been doing these school inspections?
We just started this week because of lack of resources. We have we have so much priorities that they're pulling our staff to reassign to other activities, COVID activities.
So you guys...
at this time, we have only 3 inspectors that goes out regularly.
So you're behind in inspections, Marilou?
Not really behind. Just like childcare, because we're mandated by law, we're federally funded for that. So we're still able to conduct the quarterly inspections of all childcare centers.
Have you guys been able to? I thought you guys were going to hire more people or train more people to do the inspections.
I know there's 2 pending. There's 2 pending. That's our administrative officers working on to hire 2 more or no 4 more. But I don't know what is the status of that.
Mm-hmm. But just so
those are funded positions because it was vacated because of resignation and promotion.
When you say lack of resources, is any of that related to maybe some of the DEH staff have been detailed to go help with the vaccines or whatever?
Yes, we have two staff that were pulled since last year, and from time to time, they will request us to assist. So we will be sending a few of our inspectors to assist on the vaccination outreach or the testing.
Just again, Marilou, 3 inspectors. That's all you guys got.
Yes, 3 inspectors that doing regular inspection, because other inspectors, they're assigned to other programs, just like the consumer commodities, the detainment of commodities that's coming in. So there
How
we're
many
also
total
busy
though?
on that.
How many total inspectors do you have?
Okay, we have 10, including me and Rosanna, the administrators, but we have two senior staff that on extended medical leave since last year.
So, there,
8, right?
so
8.
there's 3. Okay.
Eight on
8.
on a full-time status.
Yeah. 8, and 3 are only doing the inspections, and the rest are
Yes, but
detailed
there's
to
6.
other.
Yeah, there's 6 that can do the inspection, but they're assigned to other programs. Because we're also starting to actively doing mosquito surveillance, because what we don't want is to have another dengue outbreak. So we started actively doing mosquito surveillance. This week we have the entomologists to assist us in starting to spray, how to do the spraying, because we have the certification, but when the actual spraying, we don't have the training yet. So he's here to do the training for that.
So just so I'm clear, the 3 inspectors that you have doing the inspections, are they responsible for, because you have the COVID-19 inspections and you have the sanitary inspections, it's just the 3 that are
At
doing
this time, yeah, they're the one regularly doing the those inspections.
Oh. So when's the last time you guys have even inspected, let's say, just a restaurant?
The last time we've been doing just like we've been doing also restaurants. Just yesterday we did 5 because it takes long for us to do one inspection, because we do the sanitation inspection and we do also the compliance inspection. So there's two types of inspection that we do every time we go out. So and they go in team. So one inspection, there are times that it's only one inspector going to do on their own. But there are times that both of them, to make it faster, so one will be doing sanitation, one will be doing the COVID compliance inspection. And on the weekend, we always go out because that's the time that
People are out.
there are some restaurants operating just like a bar that we always see complaints.
Yeah, I saw something about a karaoke bar being open, Marilou, on Facebook. How is that able to happen?
I don't know, Chris, how it happened. We don't have any control on that. And when we receive the complaint, it's already after the fact. So when we go out there, we don't see anything because they're already closed.
Yeah, because we were thinking, oh, maybe they're serving tuna sandwich and that's how they're able to open.
Yeah.
But it was like a karaoke bar. So, I mean, I remember everyone saying like, oh, if you sing loud, that everyone's going to get COVID. So I was just wondering. And I mean, I sent it to Director Art, but we didn't get anything back, but I know you guys are busy.
But karaoke
Well,
bars
the one
can't be
thing
open.
the one thing that we do encourage the community to do is, as soon as they are aware of any of these violations or potential violations, to report them right away, whether it's to environmental health or to Guam police. You know, if they take a picture or a video or something, I mean, report it right away. And even if, as you know, Marilou is reporting, we have lack of resources or low resources, we have the ability, even on the weekends, especially on the weekends, to go out and inspect. As she mentioned, by the time we get there, sometimes the activity is already, you know, they've dispersed. So the sooner you report, the sooner we'll be able to go out there and be able to observe the activity as it's happening.
With this shortage of inspectors, how confident are you guys that we're going to be able to really take a close look at the bars when they reopen? And is that something that's under you guys?
We do have the partnership with GPD, and you know, I know you had Sergeant Paul Tapal yesterday, and he mentioned, you know, I recall you asked me about, you know, Joy Luck Club, which we did receive the complaint about. And when we did go out, we didn't observe anything, but fortunately we had the partnership with GPD and they were able to go out and issue a citation. So we have partnerships like that. And so we're fortunate to have that kind of support with GPD. So even if we're not able to go out and do those types of inspections or issue citations, we have that type of partnership. So with their support, we can continue those kinds of efforts.
But are they trained like to look at the public health protocols?
Not on the sanitary side, but at least in terms of enforcing the executive order, we have that side. And if, you know, if for the sanitary inspection side, then we can go in and do any type of inspection.
So can a karaoke bar be open if they're serving tuna sandwiches? Or food or whatever? Hot dogs. Poo-poos.
The little shot glass, the chorizo, you know, the one with the,
you know,
with the rice, yeah.
I mean, when it's pretty much we know it's a bar. It's a karaoke bar. Can they be open?
Can you repeat that again?
Can a karaoke bar open if they serve some type of food? Because it looks like that's how the bars that are open are the bars that are open now, is they're serving food. So it's more of like, oh, we're a restaurant / bar, not a bar restaurant.
Okay, even if they're serving food, if their category under sanitary permit is bar, they're not allowed to. If we found those violations, then we cite them and stop them of doing that activity. But what I noticed this time is there's a few bars that's been coming to our office, trying to amend their license and their permit to a cafe, to a restaurant, to a short order establishment.
Right.
But now because they come and apply that they will be approved, we have to go back and do an assessment. And there's a few, I remember maybe 2 that were that we approved to convert to a tavern, to a restaurant, because they have a full kitchen. They meet the requirements as a restaurant.
I see.
So
And one of them is Horse and Cow. They have a full kitchen and they serve food. So they were approved as a restaurant.
So that's pretty much what you have to have. You just have to have a full kitchen if you're...
Yes.
And meet the sanitary inspection.
Right.
Okay.
I see.
Or pass the sanitary inspection.
So let me ask you, Marilou, you said you know of a couple bars that have kind of had all their licenses switched up so they can remain open. Is it just those 2? Because are you tracking other establishments that have done the same thing?
I don't get
Are we getting a lot of bars that are coming in and switching up their game to be restaurants? Or
No,
just the
not
2?
a lot. There's only a few. But most of them, it's denied because they don't meet the requirements.
So like a karaoke bar, they didn't switch their business license up?
For business license, they're not it's not really necessary to amend their business license, because on the business license, all bars, restaurant, and retail or supermarket, it's retail. The description under business license is only sale of food and beverages. So it's not necessary for them to go back to revenue tax and amend or change their business license is only with public health.
Wow. How many of you guys denied, would you say, in the past few months?
It's only a few, if I remember, because my staff consulted me. There's about 3 that I remember.
So it should be pretty easy if you just look at which bars have converted and you've allowed, and then which ones are out here open, selling food, right? But then you've only got 3 inspectors. Tough. I don't know what to say anymore.
I know.
No further questions, Your Honor.
It's just, you got to be careful to me, like when you go out and eat, you know.
Yeah.
Yeah.
Okay, Marilou. So with the reopening of the bars, we're getting Mary Rhodes on to find out where we are with that. With the plans and everything, are you guys the ones that have to approve that? And are we looking at any bars, like bars, being able to reopen by, let's say, Super Bowl Monday? Which is that's Monday.
Can you repeat that again?
Are you guys going to approve any bars and their reopening plans by Monday for Super Bowl? No. Okay.
I don't think we have any requests pending
Okay.
Yeah, I don't.
in time for Monday.
Okay.
Yeah.
You good, Ree?
Yeah. Was there anything else?
I do have, today we have our drive-through mass testing in Jigo Gym, 9 to 12. So encouraging the community to come out, please get tested. I don't know if this morning when I stepped outside, it was kind of drizzling, but hopefully the weather will cooperate with us today. So, but it is a drive-through, so you'll be covered in your car.
Is there any update on the whether or not the shipment of vaccines have arrived yet?
You know, I believe we are expecting a shipment tonight and then another one this weekend. So hopefully we get one of the batches tonight, and that's for the Moderna. So we are anticipating a shipment to arrive tonight.
Are there any issues with the clinics receiving a restock of the vaccine at this time?
We are getting requests from some of the clinics, but of course we have to tell them, just wait for the shipment to arrive, because some of the clinics are running low on their stock because they're getting a lot of patients coming in and getting vaccines. So as soon as we replenish our supply with the shipment coming in, then we'll provide more inventory or more vaccines to them as well.
Okay.
All right.
Thank you, Janela.
Thank you. Thank you, Chris.
See you.
Thanks, Sabrina.
Mary Lou, good luck.
Yeah, Mary Lou.
I'm going to send some applications your way.
Make sure they have a full kitchen.
Right, yeah. Okay, I'll see you. Good morning. It's 7:49.
Wow.
Wow, that's just, it's always been an issue. That doesn't make it okay,
they've
though.
always been short-staffed.
I mean, yeah.
But, their work